So hello, everyone, tonight. My name is Dr. Keith Newby. I am the Medical Director of Health Equity for Sentara Healthcare. And I want to take this time to thank you for joining this discussion on mental health and wellness during COVID-19. The past 2 years have been very difficult for everyone as this pandemic has wreaked havoc in our lives. Tonight, we are going to explore mental health stigma and barriers to care. Hopefully, we'll be able to identify initiatives and strategies to support mental health and wellness. As we begin the event, I'd like to share a video introduction from Zoe Campbell, mother and founder of Sydney's Opportunity, who made this event possible through a generous contribution, and we are so grateful for her support. So please, let's watch this.
That may not be available to them otherwise. Zoe Campbell, I'm the mother and founder of Sydney's Opportunity, a foundation set up to help those in need of mental health services and treatments that may not be available to them otherwise, by providing financial assistance as well as access to existing resources. My personal battle with depression, in addition to the struggles I've witnessed with those I love dearly, drove me to raise awareness and empathy in our youth. For many years, I used my platform as an educator to disengage the stigma attached to mental health through my very personal experiences. But it wasn't until I lost Sydney that my purpose would expand these efforts and awareness nationwide and in her name through Sydney's Opportunity. Sydney was joyful and outgoing, but she was so sad and discouraged, a painful roller coaster of emotion that was out of her control. Her struggle with depression developed in her early teens and would surface in unpredictable waves. As a mother, it's crushing to watch her child struggle and endure pain beyond your control. Her battle with depression ended when she passed, but for myself, her brothers, extended family, grandparents, and friends, especially those already struggling with mental health issues, it would be a battle we would contend with for years. The supports and resources made available to us are imperative to our recovery. And it's important that these community conversations take place to share what these are so that other individuals and families can recover as well. An important takeaway that I hope every person who joins this virtual event will have is to know that there are resources available, whether it be support groups, available treatments, financial assistance, education, and so forth. It's a difficult road to weather, but there is help to navigate these speed bumps and roadblocks. And these virtual events serve as a bridge to promote awareness as well as access to these various types of assistance that are available.
All right, well, thank you again to Sydney's Opportunity. And we also would like to take this time to thank our other sponsors for the evening. Children's Hospital of King's Daughters and its Mental Health Lighting the Way campaign, Hampton University, Project Nana, and the American Foundation for Suicide Prevention. Tonight, we have a panel of top-notch mental health professionals who will share with you tonight. They will each give a brief presentation followed by a panel discussion. We want to hear from you, so please use the chat feature to ask questions along the way, and we will address as many as we can. We do want to maintain a positive environment where everyone feels safe, so please, let's keep it positive tonight. Keeping that in mind, the topic tonight may be difficult for some in our audience. If at any time you find yourself in distress, please leave the meeting and practice self-care. Find someone to talk with, take deep breaths, whatever you need to do which brings you comfort and safety. And please know that we are here for you. And if in crisis, please call the National Suicide Prevention Lifeline at 1-800-273-8255 or text TALK to 741-741. As a courtesy, we have posted these numbers at the top of the chat page. As Zoe Campbell said, mental health and wellness can be a difficult road to weather, but it's our hope this virtual event serves as a bridge to promote awareness and access for all. Now, I'd like to introduce our first speaker. Missy Glass is a licensed clinical social worker with CHKD, who will talk to us about COVID-19 and cultural humanity. Mitzi, take it away.
All righty. Thank you so much, Dr. Newby. It is indeed an honor and a pleasure to be with you all this evening. And as Dr. Newby said, my name is Mitzi Glass, and I'm a licensed clinical social worker at Children's Hospital of the King's Daughters. And I'll be speaking to you for a few minutes about COVID-19, mental health in children and adolescents, and cultural humility. So I am advancing my screen. I'm sorry, my screen is not advancing. Going to try something else. Okay, all righty, thank you. Sorry about that. All right, again, thank you for having me here this afternoon. I'd first like to start off with stating my identity and my positionality. I'm a Black woman that identifies as she, her with multiple intersections. And because of how I identify, I recognize that I'm accountable and grateful to all the shoulders and backs that I stand on that created opportunities for me. I believe that all people have value and worth, regardless of privilege or circumstance. I recognize my own privilege and that I have a responsibility to use my privilege to address social justice. So our objectives tonight will be that our participants will review the tenets of cultural humility. We will intersect, and so our participants will intersect the tenets of cultural humility and pediatric mental health and COVID-19. And I'm hoping that our participants will consider implications for practice. So what is cultural humility? Let's start with a definition. So cultural humility is a process of reflection to gain a deeper understanding of cultural differences in order to improve the way that vulnerable groups and under-resourced groups are treated and researched. Cultural humility is lifelong. It's a journey, and it impacts our teaching, what we teach, who we teach, and how we teach. It also impacts our learning, what we choose to learn and how we learn. I love this part is that it also impacts our research, how we interpret research. Our engagement for me is how I interface with my patients, my families, and the communities that I serve. And cultural humility also is leadership. Cultural humility honors and celebrates the beliefs, the customs, the values, and differences of others. I love this image because in this image, it took out the word I and L, those letters, and changed to A and N. So with cultural humility, it allows us to accept every human being for who they are. And that's the most exciting piece for me. So a little bit more about cultural humility. Cultural humility is a term coined in 1998 by Pavilion and Murray Garcia. And if you ever have an opportunity to look at their work, they have many videos on YouTube. I mean, they were healthcare professionals and wanted to incorporate a multicultural lens and approach into how healthcare providers worked with their patients and their families. And so they developed 3 principles. Those principles are lifelong learning and self-reflection. And that for me is the foundation of cultural humility. And also principle number 2 is mitigating power imbalances, institutional accountability. One of the things about cultural humility is that even though these ladies coined the term for healthcare, we now see cultural humility as a concept that is used in definitely social work, psychology, medicine. So we've been able to use this term in many other domains. So let's talk a little bit now about COVID-19 and children's mental health. I wanted us to look at what the AAP said, and this is directly from their statement that they put out in 2021. And they declared that we are now in a national emergency in regards to children's mental health. And COVID-19 really was what drove that emergency. The pandemic really became another issue on top of already existing challenges for our children and our adolescents. What they recognized and what they wanted us to give meaning to is that children and adolescents were experiencing increased isolation, grief, uncertainty, depression, anxiety, and trauma. What we saw was an increase in emergency room visits, especially for suicide attempts. We saw the impact on individuals, families, and the community, and it's going to have and is having a long-lasting impact. The AAP also identified, and the research pans this out, that young people and communities of color have been impacted by the pandemic more than others, and how the ongoing struggle for racial justice is tied to the worsening mental health crises. Of course, we know that young people in communities of color experience grief and loss in a way that other communities did not. One of the things that I like to remind people is that while the pandemic was happening, there was also another pandemic, and that was a racial pandemic. So our young people were really dealing with and struggling with two pandemics at the same time that affected their families and also the community. So I want to just give you a day in the life at CHKD, which is where I practice. And these are actual situations. I changed the details to protect those who, to protect the patients and their families. But this is what we've seen since COVID-19. A 10-year-old white male presenting to the ED for depression and suicidal ideations. An 18-year-old Asian transgender female with a history of ADHD, depression, and a previous suicide attempt, presenting for intentional polypharmacy ingestion. Since COVID-19, we have seen an increase in ingestions at the hospital. A 15-year-old Latinx male with sustained multiple gunshot wounds and is now medically stable, however, dependent for all of his mobility and care, being treated also for depression and anxiety. We've seen an increase in gun violence since COVID-19. So that's something else that to remember. I hear this a lot in my practice. I was doing fine in school until COVID-19. And then of course, I hear this a lot also. My child is afraid that I'm going to die like his grandmother did from the virus. So what's the reality? The reality is that in 2018, we knew that death by suicide was the second leading cause of death in children ages 10 to 14. However, since COVID-19, again, the ED visits for mental health increased 24% for children ages 5 to 11. 5 to 11. So I'm often seeing children in my emergency room who are 5 years old, who are struggling. 3% for children ages 12 to 17, and the rate of attempted suicide increased 51%. So the Intercession Statement. COVID-19 continues to significantly impact our children, our families, and our communities. Pediatric mental health challenge developed or increased as a result of COVID-19. I have many young people who say to me they were doing fine until COVID-19. They did not develop depressive or anxiety symptoms until COVID-19. And then providers have had to develop a cultural, humble attitude to more effectively address the children, families, and communities that we serve. And I also wanted to remind us that culture is not just race, it's socioeconomics, it's gender, it's community, it's religion. It's a very broad concept. So, implications for practice. So I thought a lot about this and I did some research, and there's a lot of research out there, but I wanted to get it down to maybe 3 ways that each of us can practically use the information that I've shared today. Again, to become more culturally humble, especially when we're working with our children and our families post-COVID-19. Actually, not post, we are still in COVID-19. I challenge and self-reflect on my worldview to notice differences as a way to maximize the therapeutic relationship with my patients. I don't assume that my race, my gender, or my privilege does not impact how I work with clients. For example, the words that I use when completing a mental health evaluation. Words matter. What I say, how I say it, and what lens I am using my words through is so important, and even more important when we're addressing mental health concerns now. I recognize that I may have to adjust my clinical decision-making or my theoretical orientation to align with the culture of my client. For example, making a mental health diagnosis. I think that it is important when we're culturally humble and when we are working with our clients that we really think about, for those of us who are using diagnoses, to think about what is the diagnosis that I'm giving to my client? Can I use a person and environment perspective? Can I understand the culture that they are and their narrative that they have before I give a diagnosis? So again, really thinking about and challenging and self-reflecting on that. And then finally, another implication for practice. Can I be comfortable, or I can be comfortable with not knowing? One of the things that is so important with that foundation principle that I call is self-reflection as well as lifelong learning. And so for me, that means, and for each of us, that there are going to be some things that I do not know. COVID-19 has taught us that we have to do some things differently. We have to understand ourselves differently, and we have to understand our patients and our families differently. And we're going to have to develop some new ways of assessing and some new ways of intervening. Therefore, I will allow space for my client to be the expert and teach me about their experiences as it relates to their mental health without judgment, and to really be a listener and a learner. And then curiosity without condemnation. I think in working in mental health and being culturally humble, it's okay to be curious, to want to know more, to understand more, but without condemning and without judging in a way that is not helpful for our clients and for our families, and therefore the community. A little plug here for the services that we offer at CHKD. We have psychiatry and psychology, and we have offices in Norfolk, Virginia Beach, and Newport News. We also offer mental health therapy, and our mental health therapy are by licensed clinical social workers like myself. We also have LPCs who offer therapy. Most of our referrals are physician-driven, and I did put here the numbers for pediatricians and physicians who may need to make a referral to our mental health program. This is just a snapshot of the services that we offer, but I wanted to direct your attention to that. Finally, I wanted to share with you all that actually next month we will be opening our children's pavilion, and I'm very excited about this and what this is going to offer for our community. We will have 60 inpatient beds totally by August 2022. We'll have intensive outpatient, we'll have partial hospitalization, and a host of other services. So again, I wanted to share this with you all as we're shining a light on mental health. These are my references, and I want to thank you all so much for this opportunity as we each are on this journey to become more culturally humble, to understand our patients and our clients in a deeper and richer way. Thank you so much. And I'd like to now turn over our program to Dr. Russell.
Thank you, Mitzi. I appreciate it. I'm now going to share my screen. And okay. So good evening. My name is Dr. Latonya Russell. I'm a general pediatrician and public health practitioner, and I'm practicing in Chesapeake, Virginia. I'm a general pediatrician, but I have a special interest in mental health, especially in our babies. It's my pleasure to be with you guys tonight, and I thank you for being here. Now, this conversation that we're about to start right now is just the beginning. This talk is by no means comprehensive, because I could speak for hours upon hours about the challenges and the issues that children of the LGBTQIA+ community kind of deal with. Before I start though, I do want to say a disclaimer. I am not a part of the LGBTQ+ community, but I am someone who loves my babies who are part of this community and will continue to advocate for them so that they receive the services and the care that they need. This kind of group is an opportunity for all of us to learn. Though I am given this presentation, I am not the total expert. I do not know all, but I am here to share what I do know. The issues about which we are about to speak are often just baseline challenges that children of this community deal with. However, in the context of COVID, they have become even worse for them. And this has been due to isolation. It's also been due to availability to services. And as of late, it's also been related to some of the social and political climate that we exist. So I first wanted to start with this quote by this amazing queer woman who was an activist and a feminist and a civil rights activist. And she spent the majority of her life confronting and addressing injustices of racism and sexism and homophobia. So the quote is, "If I didn't define myself for myself, I would be crunched into other people's fantasies for me and eaten alive." See, Audre Lorde knew what our goal should be for our babies and for their future. And the reason I chose this quote is because it is my hope, like I said, for our babies in the futures. I want them to be able to have the freedom and the safety to define themselves and not be confined by society's expectations of them. It is this very thing, being crunched into other people's expectations, that brings us to our current topic of the mental health challenges that children in the LGBTQ community face. My goal, and I hope that the goal for all of us, is to teach them to love themselves and to accept themselves regardless of how they are seen in this world. So before we kind of move on, I just wanted to say who the LGBTQIA+ community are. So the LGBTQIA stands for lesbian, gay, bisexual, transgender, queer, questioning, intersex, or asexual plus, and everything in between. This is a community that is very diverse. It incorporates numerous religions, races, socioeconomic and cultural backgrounds, and this is what we call intersection. Because one is a part of this community, it doesn't mean that they all share the same ideas. It doesn't mean that they, may act the same or express themselves in the same way. However, they do all experience a type of marginalization that makes them more at risk for suffering through mental health crises, specifically anxiety and depression. On top of that, they're also less likely to seek out the services for various reasons. So, as we kind of start this, I always like to kind of talk and give you kind of a background on statistics so we know what we're working with. So in general, 1 in 5 children experience a mental health disorder. 1 in 6 children aged 2 to 8 years old has a mental, behavioral, or developmental disorder. So one of the things that our friend Mitzi just wonderfully, kind of set the place for youth and the mental health is that suicide is the second leading cause of death in young people aged 10 to 24. Now, if you look specifically at the LGBTQ youth, they seriously consider suicide much more frequently than their heterosexual counterparts, and they are also more likely to have attempted it. Now, I know these numbers are hard to hear and they're very sobering, but we can definitely work to change them. But again, like I said, it's very important for us to look at these numbers so we can know just how significant the problem is. A little bit more statistic-wise. So there was a study done by the Trevor Project, which is an organization that provides crisis intervention and suicide prevention services for LGBTQ teens and young adults. And what they did is they did a survey looking at 35,000 young people. And I just you can read more of the other things, but I just want to highlight a couple of statistics. The first one is, so this was done in the last year. 42% of LGBTQ youth seriously considered attempting suicide in the last year. 75% of them report that they've experienced discrimination based on sexual orientation or gender identity at least once in their lifetime. I highlight that one because it's one of the biggest reasons why our babies are struggling so much is because of the discrimination and isolation that they may feel. Two other big ones is that 68% reported symptoms of anxiety. 55% had symptoms of depression. And 48% had been inflicting self-harm, like cutting or burning themselves. And that's a lot. And so I think that, kind of setting the scene for what we're dealing with, I think is important. A few more pieces of data. High school students who identify as lesbian, gay, bisexual are more than 4 times likely. Sorry about that. Are more than 4 times likely to have attempted suicide compared to their heterosexual friends. And I know I've said this, multiple times, but I think it's important for us to really understand how important this is to saving the lives of our babies within the LGBTQ community. The other thing that I think is really important to think about is that 40% of transgender adults have attempted suicide in their lifetime, compared to less than 5% of the general US population. That is sobering. And it is actually very scary because there are a large part of our communities that live as transgender and they have to deal with all of the extra stressors that that society places on them. So getting away a little bit from the statistics because we are limited on time, but I wanted us to kind of look at some of the risk factors for children having mental health crises. One of the biggest ones is family rejection and the lack of support from families and friends. They really just want to be seen and affirmed for who they are. So that doesn't mean necessarily that you have to believe in all, or you have to agree with everything that they do and everything they say, but still love them without judgment and being unconditional. Because of the rejection, they often will lose a huge part of their cultural or religious identity. If someone grows up Muslim or grows up Christian, and they come from a very conservative, or any other religion, and they come from a very conservative home, then if they come out as being a part of the LGBTQ community, then that can very much push them out of their community, the only community that they've known their entire lives. Also, the fact that these kiddos have to hide who they are in order to be accepted really weighs very hard on who they are as individuals. They also suffer through trauma. The other thing is that kiddos who are part of LGBTQ are often homeless, and this gives an estimated 120% increased risk of being homeless at some point in their lives. And as we know, homelessness also is a risk factor for mental illness. And then also there's just inadequate access to good care and consistent mental health services. Something that's been in the news lately is all of these legal battles, Idaho, Texas, and how these places are trying to change how people can access care. So a couple of things so I kind of want to bring it all together. Again, we're running short on time. Are tips for being an ally and preventing these mental health crises for our babies. And I think the first thing is just giving unconditional kindness and love. Avoid being dismissive, listening ears and heart and mind, and not being judgmental. I think the other thing is being present with them and also just witnessing their experiences. Help them create and find supportive communities. Also, it's important for you to educate yourself if you're not a part of the LGBTQ community. And this means, I'm sorry, I'm not sure what happened. Can you guys still see? That's weird. Okay.
Yes, we can see it.
Okay. So, well, I guess we can kind of look at it this way because it's not letting me change it back. But I think part of it is, one, like I said, being present and witnessing their experiences, helping them find a community, and educating yourself. So that could mean, understanding what the language is of the LGBTQ community. It could mean that you help them to learn to advocate for themselves for, that's weird, to really find what they need for themselves and not speaking over them. And again, call out the injustices when you see them, and then staying informed on what's going on. If you are a parent specifically, it's important to be proactive in school and to find safe spaces for them. And also, if you are looking for healthcare, finding gender affirming care. For some of my kiddos that have come in to see me, many of them have had significant thoughts about self-harm because they're not able to be who they are. So in some cases, we have made appointments for the babies, for them to come in with their parents, and they come out to their parents. And it is helpful for them to have someone who is supporting them so that they don't feel like they're alone. And I'm also, for some of my kids, a buffer for them because sometimes they're going to get a lot of backlash. So these are just a few of the things that we can do to help them become healthier and happier kiddos. So I just put a couple of the resources up here. The Trevor Project is, again, one of the larger suicide prevention and mental health crises advocacy groups for LGBTQ youth. The Trans Lifeline is another thing for our trans youth. And then also, if you're in the state of Virginia, there is a Virginia Transgender Resource List, and it includes everywhere within the Virginia for gender affirming care. And even if you're not trans, you can also use it just for LGBT inclusive healthcare. So these are some of the lists. feel free, like when you can pull them off and use them if you need them. And I just wanted to end real quick with a quote from Tennessee Williams. It says, "What is straight? A line can be straight or a street, but the human heart, oh no, it's curved like a road through the mountains." So again, love your people, listen with an open heart, and be kind. And I think we will have a lot of healthier people. So now I will turn the screen over to Dr. Christy Norwood from Hampton University as she talks about young adults, faith, community, and the veterans experience. Thank you.
Thank you so much, Dr. Russell, for that important topic. You know, we're having a very candid conversation tonight, and in all transparency, I'm having some technology issues. So as my computer is kind of getting back up and running, I will introduce myself. My name is Dr. Christy Norwood. I am a licensed clinical psychologist. I also have the pleasure of serving as the director of the Student Counseling Center here at Hampton University. And so I've been with Hampton University since the fall of 2019. And so most of my time has actually been throughout the pandemic. And prior to coming to Hampton University, I was really blessed and fortunate to be able to work for almost 10 years with military veterans at the Hampton VA Medical Center. And so much of my time has, as a clinical psychologist, has really dealt with helping individuals through transitions and dealing with transitions. And so as technology is now on my side, we are going to talk a little bit about young adults, military veterans, and the global pandemic experience. And to Dr. Russell's point, this is just an opportunity for us to start the conversation. And so hopefully there will be continued conversations, not just as a collective, but also in your individual spaces as well. So I want everyone to take a look at this. You may have seen this come across if you're on social media or just in different spaces. I want you to identify, what color do you see? And you can feel free to use the chat to put that in there. What color is this sneaker? I'll give people a moment just to kind of look at that. So some of you may see, I see pinks, I see whites, I see grays. So I see different options here, right? And so for myself, I will share, I see pink here with some tints of turquoise, right? And so as we're kind of seeing in the chat, we see that we have different perspectives, right? And so as we're talking about young adults, as we're talking about military, I want us to just keep in mind how important it is to keep the perspective of the individuals that we're talking about in mind, right? We have to be able to see the perspectives of these different populations that we're talking about as valid. And I want you all to know that your experiences, whether you be part of these communities, whether you identify as a young adult, or whether you identify as a military personnel or a military veteran, your experiences are definitely valid. And so as we talk tonight, we're going to talk about these two populations, military veterans as well as young adults. And these two populations are so important because they have been found to be extremely vulnerable to mental health challenges during the pandemic. So young adults, right? So when we speak about young adults, for the sake of this discussion, we're talking about those who are in the 18 to 30 age range, okay? So these might be individuals who are enrolled in college. These might be individuals who recently graduated from high school. These might be individuals who are just trying to get a sense of their purpose and who they are and sort of find their way. Similarly, when we talk about military veterans, we're talking also about those who may recently have discharged from the military. They may have recently come back home from combat experiences, making that transition, trying to identify their meaning, trying to identify their purpose. I know with many of the veterans that I worked with in the past, they felt like, you know, civilians, they just didn't get it, that we were built differently. And so for a lot of our veterans, that puts them sort of in that vulnerable population state. So the question I ask for you all to think about, and again, you're welcome to reflect that in the chat. Again, knowing that we're in a positive space and I love the energy already. But the two questions that I want you to think about are, what are some of the challenges as you see it that are facing young adults as we still continue to navigate this global pandemic? What are some of those challenges facing young adults during the pandemic? And as I see those sort of starting to come in, I'm going to ask you all similarly to also ask yourself the question. Thank you, Dwight, for adding fear, isolation. I see isolation change coming up. And so similarly, as you're reflecting on young adults, also, I'd like you to reflect upon our military population. What are some of the challenges facing our military during the global pandemic? PTSD, challenges with getting in access to care, fear, substance use. Absolutely, you all are exactly on the money here. And so we're going to kind of talk about what this looks like and some of the overlaps between these two communities. Very good. Loss of community, loss of purpose, deployment, access to care. Absolutely. I appreciate the energy around this discussion. So where does the journey begin for many in these populations, right? It looks like this. So this picture sort of depicts, if you think about it, people walking around, it looks like New York City, but people walking around a city going on their merry way, right? Before the pandemic, they may not have had masks on, right? Now maybe things look a little bit differently, but for many of our young adults in our military, it's sort of like, where's my journey? Where am I going? And why is everyone moving around me? Where are they going? Do I join them? Do I stand still? What's happening around me? You know, for some of us, it looks like this, right? It looks like sort of sitting in a space where we feel like we're really isolated, feeling tired, not sure what's happening around us, feeling like no one else can kind of connect to us. These are some of the common experiences within both of these populations. And for some in these cohorts, right, they might feel like this individual. They might walk around with a smile, but meanwhile, they're carrying such a heavy load trying to navigate day-to-day interactions. And when you add the pandemic to that, it only increases the level of distress that they've been experiencing. So when we look at the data, particularly, and we'll start with young adults, right? According to the CDC, young adults reported the highest levels of anxiety and depression that's ever been reported as a result of the pandemic. And so those numbers, and I'm not sure if this is surprising to you all, but those numbers have hovered around 63%, right? And that's reported. And we know that sometimes people underreport their mental health symptoms. What we know is that a lot of this is due to, you know, this sort of unexpected situation that has arisen, right? This unexpected trauma, significant stress. And for many of our young adults, this is the first time in their life that they're experiencing this level of distress, not just for young adults, for many of us, right? Who may be outside of that category. This is the first time we're experiencing those levels of distress. Now, when we think about young adults, and especially with college students, we know that the data shows that anxiety and depression is particularly pervasive. And so what we're seeing with the trends is that those levels have continued to rise as a result of the pandemic. So let's look at this. How does this show up? And I appreciate Ms. Glass and Dr. Russell, because they've kind of set the stage for this already, right? So we know that there's challenges with young adults with social connectedness, problems with purpose and meaning, anxiety, depression, grief, and loss, right? For some of our young adults, right, they're trying to find ways to connect to peers, right? They're trying to figure out, what is my purpose? What am I supposed to be doing, right? And all of these questions and trying to figure it out may lead to feelings of anxiety, may lead to feelings of depression. In addition, grief and loss. For many of our young adults, this is the first time that they are experiencing the threat of loss or also actual loss. It may be a grandparent, a great grandparent, it may be a parent, right? And so they're having to navigate these very new and uncomfortable emotions. And as we look at our veteran population, we know veterans may be particularly vulnerable to experiencing pandemic-related stressors, including economic issues, exacerbation of pre-existing mental health symptoms, and even lack of support. That's what the data shows us. So with our military veteran population, again, you'll see that connection, right? These challenges with social connectedness, right? I would get together at the VFW with, you know, all my fellow veterans, and now we can't do that in the same way. Now I have to learn technology in a different way. You know, how am I going to sort of connect with those who I feel that understand me, right? And so those challenges come up. In addition to that, we see higher levels of distress, right? Particularly when returning home and then returning home to a traumatic experience or an extremely stressful experience. Many of our veterans may find themselves wondering, about employment, about housing, about financial strain, and all of these are just a perfect storm for creation of distress. Similarly, that readjustment process. Now, veterans are not necessarily just having to deal with some of the readjustment related to their military experiences, but also how do I adjust or readjust to my new life within this pandemic? And then finally, as we saw with our young adults, grief and loss, right? So grief and loss surrounding loved ones, but particularly with military veterans, honoring those who have been lost, not being able to go to funeral services or memorials in the same fashion, or having to wait longer periods of time to be able to start that grief process. These are some of the things that we find that our veteran population is experiencing. And so this kind of helps to drive home that point, which is that veterans may be particularly vulnerable to, again, that pandemic stress and that exacerbation. But what we know is that if they have social support, that can definitely be a protective factor. And so here we see veterans with larger, what the research shows is veterans with a larger pre-pandemic social network size are more successful, right? They're able to deal with those loneliness, those changes, those challenges in a better way. And so what do, right? We want to help our veterans, we want to help ourselves, we want to help our young adults move towards what we call healing. And so healing occurs when we make the shift from thinking about the challenge to actually allowing ourselves to feel our emotions. What we know is that if people can build these resilience skills, right, then they can adapt and they can manage some of the stressors related to the pandemic, right? They can have a healthy quality of life. And so this journey really begins with starting to ask yourself and starting to ask those who are part of these populations some of these questions. You may ask your fellow veterans, or you may ask your loved ones or your young adults, what do you value? What's important to you? How are you actually coping? What coping strategies do you need, and how can I help you, right? What resources do you have? I may not be the resource that you need or that's a best fit for you, but how can I help you get connected with the resource that's great for you? And then how have you been adjusting? Asking these simple questions can start the conversation in the same way that we're doing tonight. And so we have to be careful of two pieces with this population: avoidance. So one, rushed healing, right? We don't want to rush the healing process. This is a very stressful time and experience for many of us, and we have to be careful to allow the time and space to do the healing work, particularly for our young adults who are just joining many of us developmentally, and our veterans who are, dealing with the transition back home. The other piece is avoidant healing, right? We don't want to just put our head in the sand. We want to be able to be in a space where we can actually deal with what's happening and acknowledge the feelings that we have. And so how do we do this? So I'm a big fan of acronyms. So I created this acronym. You are welcome. It is called Face Me, right? And so these are just some strategies that you can use that are for veterans as well as young adults to allow ourselves to be able to move through this pandemic in a healthy way, allowing yourself to feel emotions. Acceptance, right? That's a process. It doesn't mean you agree with it. It just means I'm going to acknowledge that this exists. Creating room in your life for those things that you value, whether that's exercise, connecting with others we've talked about, eradicating those old beliefs. Using what we call mindfulness and meditation exercises can be really helpful for allowing us to relax. And then for all of us, embracing discomfort. I hope someone will put that in the chat. Embracing discomfort, right? Because this is a very uncomfortable time. And so we have to all acknowledge that. And when we acknowledge that, we actually can connect more, right? So if I know that Miss Glass is experiencing, challenges or sadness because of the pandemic, I now feel connected. I don't feel as alone. And so we can kind of share in that discomfort together. And I also try to be really practical, right? So in working with college students and with veterans, I often hear, what do we do, right? Like, what can I do? Where do I start? And these are some concrete skills to start with. General hygiene. What we know is that if people don't get good sleep, good exercise, my goodness, right? We're going to be more irritable. We're going to have challenges. So you want to make sure that you're getting good sleep, good water, all that good stuff. Healthy journaling, right? Just writing down your thoughts, painting. We even have like art therapy as an example. Exercising is a way to release some of that physical energy. We talked about breath work, so mindfulness, deep breathing, gaining support and connection, whatever that looks like for you, right? We're going to talk about resources today. And so being able to find your folks, people that you feel comfortable and connected with. And then of course, finally, mental health care as well. And so as I kind of round the curve to sort of wrap up, I want to share with you all some resources that can be helpful for young adults as well as for military veterans. So you'll see a link to our link tree, and I think she might be on tonight. Two of my team members, Mr. Wampler and Ms. Burgos, they do a beautiful job with our social media here at Hampton. And so they have put together this sort of resource guide that you can click on. It has lots of resources for young adults in particular. And then you'll see some other resources listed here. Mental Health America, I think is great. The Stephen A. Cohen Military Family Clinic is wonderful. They do lots of work with family members and with veterans. And COVID Coach is an app that has been developed specifically to target military veterans, but it can be applied to other populations as well. And finally, I'd like to share with you all, this is what we use here. As I mentioned, our team developed this resource guide here. What we know about young adults and military veterans is that sometimes they don't want to disclose everything right off the bat. And so it can be so helpful to have an app at 2 a.m. if they can't sleep, that they can go on and practice these exercises. Social media is very big for young adults, so it can be helpful for them to have some Instagram pages. Oftentimes, even on our campus, our young adults will talk to peers and they may, say, oh, I saw this person, on Instagram and they said it would be helpful. I saw this TikTok video, so I decided I needed to go ahead and get some support. And so this may be the conduit to help get them the support and the care that they need. And so as I close, I just want to share this quote with you all, right? This process takes work. Right? The challenge of getting through the pandemic, whether you're a young adult, a military veteran, or otherwise, right? It takes work. And so this healing process that we're all going through, it takes a lot of courage, and we all have courage. We might have to dig a little bit deeper. We might have to step outside of our comfort zones. We might have to ask some of those difficult questions that I mentioned to you all. But if we dig a little bit to find it, it's there and it can happen. And finally, as I mentioned, you are welcome to, if you want some additional resources, you're welcome to visit me on my website, or if you're into social media, I like to post just inspirational sorts of things on social media, and also amidst the pandemic, started a podcast just to help us all in this journey. So again, it has been my pleasure to join you all and to talk a little bit about young adults and military veteran population. And at this time, what I'd like to do is pass the virtual microphone to my colleague, Dr. Jonathan Smith, and he will talk to us from the Wellness Collective perspective. Thank you all so much.
Well, thank you. That was a wonderful presentation. I love what we've heard so far. And Dr. Norwood, I want you to know that I am a proud Marine veteran, and you really just made my day just hearing about that. I just loved it. And you were right on the money. Let me introduce myself. I'm an organizational psychologist, and I'm a marriage and family therapist. And I'm also from Tennessee. So if you hear my accent, just deal with it, okay? No, so some things I may say that you don't hear right away, but I'm trying to open up share my screen now. Hey, look at that. Okay, so let's go. All right. So like I said before, I'm an organizational psychologist, just a little bit different from a clinical psychologist. We study groups of people, and when you have a group of people in the same area for a long amount of time, that group of people that creates a personality. And so I treat that group personality. And so what better group is there than the group of a family? Okay, so families is to me the most exciting group. Now, so let's get started. So I'm going to share with you the COVID-19 family experience. So during this presentation, I'm going to share basically what I've heard from my clients. If I didn't say, I'm a therapist in private practice, and I see mostly family, couples. Well, I see everybody, but mostly I see couples and families. And so here's some things that I've heard during this time. I want you to try to, if you can, I want you to try to imagine a mobile, that you have over the pretty little babies that be in the crib, and that you have the mobile, and you're looking up and you see that mobile, and you see it may have 4 things hanging on it. It may have 10 things on it, but still it's a mobile, right? And then you notice that if you reach up and if you reach over and you touch a piece of that mobile, you pull it or you pick it up, the whole mobile will change, right? Because that is a system. And that's how systems work. You change one part of the system and then everything changes. And so I'm here to say that the family is a system. So what happened is you have external factors that can move the system. And external factors also may cause dysfunction within the system and affect the system negatively. All right, so the first thing that during the COVID pandemic that affected the system negatively, or the external factor, is quarantine. Human beings, we are not made to be alone. And so now we had, then we had a quarantine. So we were mandated to stay in our houses, to stay away from people. And that right there was the beginning of the trauma on the family, because it was mandated to stay away from people. And then we have lockdowns where we couldn't leave, we could go but so many places. And that there again adds to the trauma on the family. The next thing was, Lord have mercy, was our kids staying at home. Now, and that brought trauma on the family, because some families, you have working moms, single moms, and what about the single moms who were helpers, and they could still go to work, but then they had to worry about their little kids that are home because the schools are closed and they had to do distant learning. And so that right there caused a whole different level of stress on the family. And so when you have the isolation that a family, that is an enemy of the family, and then you have the extra stress of trying to figure out what to do with your children while they're stuck home during the pandemic, learning on the computer. I'm just very grateful that my mother-in-law lives with us. And so our daughter was able to stay at home with her granny, but that wasn't always the case with other families. And so the next thing that happened was then we had to work home remotely. Some of us had to stay at home. Now, if you can imagine, some people think that working at home would be a positive thing, but some people work at home and all they do is work then, because now they're at home. And so I've heard from my clients, like when they're at home working, they actually work more because they think about what they got to do, they just get up and do it. And so now you're isolated, you're working more, and your children are staying at home and they're getting sad because they can't see their friends. Some children working on the computer is very, very tiresome, very cumbersome. I remember many a times my daughter was sitting on the computer crying because she couldn't concentrate because she was not in the classroom. Now, another thing that happened during the pandemic was mental health. Anxiety became a bigger issue in the families. I have a little statistics here. I'm not as profound as these other presenters are, but I'm going to share with you a little statistic here. Is before the pandemic, anxiety in families, was like 6.1%, in adults. But then after COVID, it went all the way up to 35.9%. That is a significant increase of anxiety experienced within the family unit. And then another one is depression. Depression before the pandemic was 7%, experienced in families. And then after the pandemic, it rose all the way to 30%. Now, let's pause here and think about this for a minute. So we were forced to stay in the house. We were forced to isolate, right? And we're forced to just kind of turn into ourselves during the pandemic. And so then we're anxious because we don't know what's going on in the world. We don't know what's going to happen next. And then we're experiencing depression. And look, the enemy of the family, like I said, is isolation. One of the things that depression wants you to do is to isolate. And so now, but too much isolation is crazy making to me. And so now you're isolating and you're isolating and you're isolating. And then that causes it's like a negative cycle. And so the pandemic caused families to go into a negative cycle. And then other external factors was drug abuse. A lot of people in families, a lot of my clients relapsed because the stress from being trying to maintain their family structure in the pandemic. A lot of them relapsed, and some people started using, started buying more alcohol, started using drugs more freely because they were in a different place in their lives, because to not be able to interact with others and everything is on a computer screen can be stressful. Another thing that started to happen in families is domestic violence. Now, domestic violence has always been there, but it started to increase during the pandemic. Why? Because human beings spent more time at home, more time, isolated in the house, tempers raised, and then violence comes thereafter. And so that right there is a major external factor that causes stress on the family. Another thing that happens during the pandemic is the idea of loss of your family members. A lot of people during the pandemic lost family members, not just because of the pandemic, not just because of COVID, but other family members, could have died of natural causes. But then again, or other conditions. But then again, you're stuck in the house, you're depressed, you're isolated, and to top all that off, you can't go see Uncle Rufus being buried at the funeral because they have a limited amount of people that they allow in. And so there again, that is an external factor. So I didn't list all of the external factors. There are some external factors that's unique to your particular family. And so if you have any external factors that you didn't see and you want to share them here, this will be a good time to do that. Okay, so the grief factor is really important when it comes to loss of family members, because if you cannot properly go through the grieving process, and then that right there makes it more difficult for you to heal. Now, if you're stuck in the house and like, for instance, I did have an uncle that passed away and I couldn't go to his funeral because only so many people could go. And so that extended my grieving process. I had no closure, okay? And I felt even sadder because I couldn't go. And so that right there is another factor that causes problems on the family. And another external factor, which is obvious, is that we lost our jobs. Some people lost their jobs and they lost their livelihood due to coronavirus, okay? And so we were just under increased pressure to just stay alive and just to survive. And that right there, because now we're worried about how we're going to buy food, how we're going to pay pay our car notes, how we're going to do things like that, and that increases pressure. Because your family now is under so much pressure, it's like a boiling pot. Look, I'm gonna tell you that this year I have counseled so many families on the brink of divorce, on the brink of splitting up because of the pressures from the pandemic. And so, what then shall we do? Oh, by the way, I'm a man of few words, so I'm almost done. So don't worry. So it's like, what then shall we do? Well, we should. I want to present you guys a concept here to help you with your stressful situation. My wife, she's a dancer, and I remember seeing her years ago, just spinning, just doing this spin, this beautiful spin. She's turning a pirouette. She's just spinning, and I just had to ask her at the end. I said, how in the world you do that without falling down? And she said, the way that I do that, hun, is I spot. Okay. And she said spotting, how she described it to me was, I found a point outside of myself and I look at it and I turn and I try to look at it as long as I can, and it keeps me from toppling over. And so I think that in life, we need to spot too. And we need to assess the situation. I heard earlier, I think it was Dr. Norwood who said it, that you got to admit or acknowledge what's going on. As a family, they need to assess the situation, instead of hiding it or swallowing it and holding it in. You need to assess it. You need to be able to say, hey, this is very difficult. Hey, I'm feeling sad right now. Hey, I'm feeling anger right now. Hey, I'm feeling alienated right now. You assess the situation, because only then, after you assess the situation, can you proclaim your desired outcome. Okay, so what I mean by that is it's not some fancy magical thing that I'm talking about. I'm talking about saying what you want to see happen. It's almost like good positive self-talk. We need to always include good positive self-talk. Like if I'm sad and I'm depressed, I need to say, well, I'm very sad about the situation, but I know it's not going to last forever. And I'm going to get better. I'm going to take, if I'm on medication, I'm going to continue to take my medication. I'm going to be a better husband, a better father. I'm going to do, you proclaim your desired outcome, because part of the problem, a part of the situation is if you're stuck in it, you don't proclaim how to get out of it. The next one is you look outside of yourself. Now, the previous presenters all gave wonderful resources, okay? And that is a part of looking outside of yourself. Don't look in, don't get sad, don't get wound up with all of the pressures of the family, but look outside of yourself for help, okay? Go for people who belong to a faith-based community or any community, go to those people who you trust and ask them for help, okay? And go to them and let them pick you up. Never think you're gonna find everything you need just by closing in on yourself. There's always people out there to help you, because it does indeed take a community or a village to help us all, okay? And then the next one is turn it around. And so as you look outside of yourself, as you assess the situation, as you proclaim your desired outcome, as you look outside of yourself for help, and then you can turn it around. And I think that's a pretty good thing. Now, I made that up, just like Dr. Norwood made hers up. I made that up too. Ain't that cool? Anyway, and so yeah, that's why I put my little thing on there for the Wellness Collaborative. Okay, so I did not build a resource page. What I did was I put my information up there, and because with the idea of looking for help, you need to find a good practitioner that you can talk to and you can trust, and someone who has a large referral network. All right, and so that is pretty much all I would have to say about that. I'm like Forrest Gump. That's all I got to say about that. And so now I would like to turn it over to Betsy Rhodes of the American Foundation for Suicide Prevention. Thank you again for listening to me.
Thank you so much. That was great, Jonathan. That was terrific. Thank you, Dr. Smith. I'm Betsy Rhodes, and I've got to talk really fast, so listen up, and because we are running over, but it's been such a wealth of information. It's so important, and thank you so much for being here tonight. I'm Betsy Rhodes, she, her, hers, and I am not a clinician. I don't have any letters behind my name. Like my, I'm not as accomplished as some of my other fabulous panelists. But what I am is a regular person who has become through life lessons an expert in suicide and suicide prevention. I'm an 18-year volunteer with the American Foundation for Suicide Prevention. We're a national organization, 35 years old, found in all 50 states. The AFSP is run 99% by volunteers, just people like you and me. And we love clinicians too, and we love researchers, and we love any profession. We just are run by everyday people because we believe that everyone plays a role in preventing suicide. So we all want to be on the same page. So first, I want to address something. On the Facebook page, when Sentara publicized this, some folks were venting a little bit, I like to think, but some of them said, well, wow, isn't this late that you're doing mental, wellness during COVID? That's a bit late. We're almost over this now. And like you've heard from the other panelists, no, we're not. We're not out of the woods yet. A few years ago, the US Army did some research, and they found that in areas that had been hit by a natural disaster like a tornado or a hurricane or a flood, that those communities who had suffered that devastation also suffered a spike in suicides. And they called this disaster fatigue. Research shows that during any major crisis like the pandemic, mental health can actually improve. In the beginning, as everyone pulls together, everybody's got this, let's do this. They're trying, they're all pulling together to cope with the crisis. But in the aftermath, there's a void, and the community cohesion diminishes, and disaster fatigue can occur. And I say can because while it's possible, there will be more suicide deaths due to disaster fatigue in the year or two to come, it's not predetermined. Just as the AFSP teaches that everyday folks like me and you can intervene before someone takes their own life and even save our own lives when we have a crisis, communities can also intervene to prevent or lessen the mental health effects of disaster fatigue. We are doing that right now tonight. And I am so thankful to Sentara for continuing this really important conversation and by offering events like this. Research shows that talk saves lives. And the more we talk about mental wellness, risk factors, self-care, suicide, the more mentally healthy and suicide safe our communities become. So now, what's the number one question I'm often asked about suicide? It's, what is the cause of suicide? Why did my loved one die? Well, the reality is there is no one cause. There is no single reason that a person dies by suicide. Suicide is a complex health issue with many layers. It most often happens when someone with multiple risk factors has a life stressor, like disaster fatigue, like the pandemic, and they have access to their means for death. And yet we also know that if we can identify who's at risk and we can build protective factors or into their lives, like having a safety plan, having a supportive community, and treatment. If we can do all that and we can help remove the means for those we know are at risk, we know that we can prevent suicide. In the same way, when our systems, our educational systems, our healthcare systems, our governmental systems, when these systems look at suicide, they also ask, what's the cause of suicide? And again, there's no one cause on a systematic level. The reality is that's magical thinking. Because if you think there's one cause, then it's easy to fix, right? Well, it's not. The causes of suicide on a systematic level are in a community or ignorance about the issue, fear about the issue, afraid of doing the wrong thing, the conjoined twins of stigma and shame. And last, the lack of will to act, to change what needs to be changed, to put the money into it, to use all of our time and our talents and our treasures to help fight suicide. The AFSP, again, has been around for 35 years, and they've worked diligently. We fight ignorance with our public education programs, and we bring them to communities at almost no cost. After this call, you're going to get an email, and it's going to have a bunch of resources. Visit AFSP. There are chapters in all 50 states, and we come to you. Very strong chapter in Virginia and in Northeast North Carolina. In North Carolina, incredible. We go to houses of faith, we go to communities, businesses, and we teach these awareness, these risk factors. We teach you about how to identify somebody at risk, what to do, what are protective factors, all of this, and how to intervene, how to ask the questions. We fight fear with science, and we guide these people and systems to do the right thing. We dispel stigma and shame by support for those affected by suicide, those who've lost someone to suicide, those who struggle, those who have attempted suicide, and two, those who live with someone that they fear might die by suicide. And we develop and facilitate the will to act within our communities by empowering volunteers and community systems, schools, healthcare systems, businesses, and giving them the training and the tools they need to act and make change, and also to raise the much needed funds we need to fight against suicide. So how do I learn more? Again, after tonight's program, you're going to get the resources, but you can go to afsp.org and find out all about us and what we do. We are working with Sentara and their health equity team to really bring suicide awareness to its footprint, the Sentara healthcare footprint, and we could not be prouder. So very briefly, I was asked to serve on this panel, and I was so excited to bring this opportunity that I didn't even find out the date. And later, when Iris Lundy, the Director of Health Equity at Sentara, I said, "What's the date, Iris?" And she said, March 22nd. I had to smile. My son, Luke, would be 42 today. Today's his birthday. In 2003, Luke died by suicide, and it devastated our family. I went to books to learn, and thankfully the AFSP had been researching, and the more I read, the more I saw their name, and the more we connected with them, and the more I learned. And to paraphrase Maya Angelou, when you know better, you do better. We as a family were ignorant about mental health and about how to prevent suicide. And we didn't know that Luke had so many risk factors. We didn't know. And so because I had 3 other beautiful children, 2 daughters, Caroline, Jordana, and Jonathan, I knew I had to do better. So I learned everything I could. I mean, we learned, my husband and I, Bernie, we learned about the risk factors. We wove in the protective factors. We talked openly about getting treatment. We all got treatment. The family got treatment. We went to support groups. We embraced everything we could as protective factors and became a family culture that was smart about mental health and how to prevent suicide. But I still worry, can really all this work prevent another suicide in my family? Well, life goes on, and fast forward, years go by, and our youngest son, Jonathan, shows signs of depression in 10th grade. But we were on it like Donkey Kong. I mean, we got on it. We got him the treatment he needed. He talked about his depression because he had learned to talk about his feelings without shame. We openly shared our own struggles, and we thought all was well. And then about 18 months into it, he was feeling great, and he was in his lunchroom at school, and he had a panic attack. And years later, he told me, "Mom, my brain kept telling me, you need to leave this earth." And that crisis, that suicidal crisis, all of that unconscious teaching kicked in. And Johnny went directly to the guidance counselor, laid his keys on the desk and said, Mr. Dietz, I am not safe to drive. Call my mom, have her call my therapist and tell her to pick me up right now. I need to talk to my therapist right now. That 16-year-old kid knew how to save his own life. Johnny still lives now and then with episodes of depression because it's a chronic health condition. But the man that he is now, he's 25, he knows how to manage it. He knows what to do. He also has an extremely supportive family who's there for him. And two, he is one of the most high functioning humans I know. He's a U.S. Marine Corps veteran, woohoo, Dr. Norwood. And you'd better believe he needed his health training when he was in Parris Island. And Jonathan is a proud Virginia Beach firefighter living his best life every day. I know suicide can be prevented. My family is living proof that when we live in ignorance and fear about suicide, it strikes. But when we live in knowledge and when we are proactive, suicide can be prevented. I thank Sentara Healthcare for this opportunity to educate the public about suicide. I thank you for being here. And on a personal level, I thank all of you for allowing me to help make Luke live longer and larger. This is my boy. Happy birthday, Luke. And now I'm going to pass it over to Dr. Nadra Moncrief-Craig. Thank you.
Oh, thank you, Ms. Rose. What a great presentation and a wonderful story. Thank you for sharing your family experience with us. Guys, my name is Nadra Moncrief-Craig. I am the System Director for Behavioral Health for Sentara. I started here October the 10th of 2021, and I have enjoyed every moment, especially being a part of great seminars like this one. I want to tell you that I started my career in mental health, working for the Alabama Department of Mental Health, running a large geriatric psychiatric facility in the state of Alabama. Later, I transitioned to a CEO of an IDDD facility for the state of Alabama Department of Mental Health. I'm also a licensed nursing home administrator, a licensed assisted living administrator. I am a compliance officer, and I enjoy dedicating my time to helping those in need. I would like to start by letting everyone know that we do see your questions in the chat room, so make sure you put your questions or your comments in the chat room. And for those who are asking for help, would you please put your information in the chat room also? And at the end, we're going to give you some resources, or we'll contact you if you would like us to contact you. There are some 800 numbers that was provided, 24 hours day services for suicide hotlines. So make sure you guys reach out if you need help with anything, or if you're having any family members that might need some help. So I'm going to start my first question for Dr. Russell. Dr. Russell, what are some of the things that a parent can do to help their children who is experiencing mental health issues in order for their child to feel comfortable talking about what is going on with them?
Well, thank you everybody for all of your amazing presentations, and happy birthday, Luke. And thank you for the question, Dr. Moncrief. I think the biggest thing, and I have this question a lot with my families, is to listen. I think so often we as adults feel like we know, and sometimes we don't listen. And even if we say we listen, we only half listen because we have a response. So we're just hearing, we're not actually listening. So I think that's like the first thing. And I think also just love your babies. Let them know that regardless of their choices, whether you believe in them or you agree with them or not, their choices will never change your love for them. And also just have their backs, like regardless of what is going on. I love you. I will always love you. I am proud of you. I can't tell you how many babies I have who I work with, who I tell them that simple thing and they sob. That's all they want to hear. I love you. I'm proud of you. I see you. I'm listening to you.
Okay.
It's simple. That's it. All right, I'm gonna shut up because I got plenty more, but I'm gonna shut up.
Thank you so much, Dr. Russell. Appreciate that. My next question is for Ms. Rhodes. Ms. Rhodes, people may have experienced multiple losses during COVID pandemic. What resources are available to help them and others experiencing grief?
Excellent question. Now, our grief, our bereavement packages and our healing conversations and things like that are for people who've had a suicide loss with the AFSP.org. But there are many organizations, and actually I can send some of those to the resource list if you'd like. But things like Compassionate Friends is wonderful. We plugged into a support group, and that was a tremendous help. And because you heard other parents and you heard other people and their losses, and you comforted each other. I would also say find a grief therapist. When you receive the email tonight with the resources, you will have links to where to find a therapist. We have a link in the resources, and you can look for therapists who specialize in grief therapy. It's so important because many therapists, while they may, it's a specialty. And so I would say look for a grief therapist, find a support group like Compassionate Friends, and if it is a loss related to suicide, reach out to the AFSP.org. And I believe we're going to be sharing some of our information too, our emails and things like that.
Thank you so much, Ms. Rose. My last question, since we're running out of time, guys, I want to be respectful of everyone's time, is for Ms. Glass. Ms. Glass, COVID has exacerbated many individuals needing mental health service due to isolation, working remote learning, and virtual social events. What kind of advice would you give someone who tells you they are feeling less than themselves and have no desire to keep going because they don't feel COVID will ever end and life will never be normal again?
Okay. I would say the first thing is to give meaning to the narrative and their trauma. Give meaning to the narrative because it is traumatic. And words matter. That's one of the things that I truly believe, not just, oh, it doesn't, to have an attitude like I understand, or everything's going to be okay, because in that moment, it doesn't feel like everything is going to be okay. So really to be able to sit with people, to be able to join them on that journey, I think that's where you have to start, and to engage them in conversation. I want to hear from you. I want to hear your narrative. I want to hear your perspective. I think is where you have to start. The other piece of that is, and it's a journey. It's not going to, it's not going to quickly just be better. Because COVID, our normal is not going to be like it was before 2020. So we are going to have to redefine normal, and we are going to have to redefine who we are in this moment and who our friends and our families are. The other piece that I think is so important, I think everyone's sort of alluded to this, is if persons are not in a safe place, and I'm always careful about how I use the word safe, because safe is not interpreted the same way for everybody. Okay, some of my patients tell me when they hear safe, they think of the police. But if you identify that someone is not in a good space, please recommend that they seek emergency help and be with them in that moment. Don't leave them alone. That would be my piece on that, and certainly to access any resources that you can. But just the first thing, just give meaning to what people are going through and sit with them and walk with them through their space and their journey.
Thank you so much, Ms. Glass. Guys, now I'm going to turn it over to Iris Lundy, the Senior Director of Health Equity for Sentara. Hi, Iris. How are you doing?
I'm doing great, and thank you so much. I want to thank you, Nadra and Dr. Newby, for moderating and introducing. I certainly want to thank our sponsors and also all of our speakers. And thank you, the audience, for participating, the great questions and comments, and all of those reached out and just being transparent just want you to know that we will be sharing these resources with you. You will receive our email, a survey link. This is just the first of many to come. So we'd like to understand what you enjoyed, where you saw that we have opportunities, and then what other topics would you like for us to cover? And I know we're right at the 7:30 mark. So with that, I am going to again say thank you to everyone and good night.